Bismillahirrahmanirrahim. Assalamualaikum everyone. Today the topic of presentation is astigmatic lenses. At the end of this presentation, the audience will be able to define astigmatic lens, differentiate cylindrical lens from toric lens, understand optics of Maddox rod and its uses, define conoid of Sturm and its importance, understand optics and proper use of cross-cylinder in clinical practice. The word astigmatic is derived from Greek word a means without and stigma means point or focus. So astigmatic lens is a lens which is without a point or single focus. In astigmatic lens, all meridians do not have the same curvature and a point image of a point object cannot be formed. There is formation of a line image of a point object. The lens gives a minimum power in one direction and maximum power in the other at right angle to the first. How astigmatic lens differ from spherical lens. Take spherical lens as a basketball and astigmatic lens as a rugby ball or American football. In spherical lenses, all meridians have same curvature. Refraction is symmetrical and point image of point object is formed. In astigmatic lenses, meridians do not have same curvature. One is steep and other is flat. This one is the steep meridian and this one is the flat meridian. Light rays from a point source that falls in the steepest meridian are refracted as if they have encountered a spherical lens of higher dioptric power. Light rays that fall on the flattest meridian are refracted as if they have encountered a spherical lens with less dioptric power. This is the point source of light. Here is the plane AC which has less refractive power and here is the plane BD which has more refractive power. The plane BD will form a proximal focal line and the plane AC which has less refractive power will form a distal focal line. Thus the focal length varies with choice of meridian and the astigmatic lens do not form the image of the point source of light at a single point. There are two types of astigmatic lens, cylindrical lens and toric lens. Cylindrical lenses have one plane surface and the other forms part of a cylinder. There are two types of cylindrical lenses, concave and convex. The axis of cylindrical lens is meridian of no divergence power. At meridians at right angle to axis, the cylinder acts as spherical lens. This is the axis 180 degree. At this angle, at this meridian, the cylinder has no power. Cylinder has power at 90 degree to it. The total effect is the formation of a line image of a point object. This is called focal line. This focal line is parallel to axis of cylinder. This is the focal line as you can see and this is the axis meridian and it is parallel to the focal line. The power meridian is at 90 degree to the axis meridian. Here is the cylindrical lens at axis 30 degree. So at 30 degree axis it has zero power. Its power is actually acting at 90 degree to it. When you add 90 degree to 30, the power will be acting at 120 degree. Here how it is presented on a power cross. This is +2 dioptric cylinder at axis 90 degree presented on power cross and this is +3 dioptric cylinder present at axis 180 degree presented on power cross. If you have difficulty remembering the conventions of power cross notation, then picture this way, that is cylinder oriented along the notated axis of power. Then you will visualize it this way, then meridian of power is at the 90 degree to it. It will be obvious. Now how we identify cylindrical lenses? When cylindrical lenses are slowly rotated around its optical axis, the object seen through it becomes distorted. This is called scissor movement as the cross lines are progressively displaced. The convex cylinder lens object moves opposite to lens motion and concave cylinder lens object moves with the lens. Now here's the video. The next slide. First we will draw cross. Then we place the lens at its axis parallel to the cross. It is causing no distortion of the cross. When slowly rotated, the cross is moving the opposite direction. So it is a plus lens. It's a converging lens. Now this is a minus lens. When you slowly rotate it, the cross is moving along the direction of the motion. So it is a concave lens. Cylindrical lenses are used in standard trial lens set for correction of astigmatic refractive error and is also used in Maddox rod. The axes of cylindrical lenses found in standard trial box set are marked to indicate the orientation of original axis of glass cylinder from which the cylindrical surface was derived. For example, we obtain +1 diopter cylinder power in horizontal meridian by slicing the surface from a glass cylinder vertically, like that. So it will be denoted as +1 diopter cylinder at axis 90 degree. Maddox rod, it is a red or white lens consisting of series of powerful cylindrical convex lenses mounted side by side in a trial lens. It converts a point source of light into a streak of light or a line image which is perpendicular to axis of cylinders. I have brought these two here, which I will show you later on. As Maddox rod has convex cylindrical lenses, at its axis it has no power and perpendicular to axis it has power. So rays behave differently when they are parallel to axis and when they are perpendicular to axis. Now the rays which are parallel to axis. As we know, the axis has no power, so rays will go undeviated and it is brought to focus by eye. A row of foci are formed on retina. These foci join up and seen as line of light at 90 degrees to axis, which is seen as composite line image by patient. It is actually a virtual image, not a real line image. Now rays which are perpendicular to axis are converged by each cylinder to a real focal line between rod and eye. This is the line. This focal line is too close to eye for image to be formed on retina by focusing mechanism of eye. Light is thus scattered over wide area of retina. In a nutshell, the red line seen by patient lies at 90 degree to axis of Maddox rod. It is formed by focusing mechanism of eye and it is not the real line image of the Maddox rod. Now let's discuss Maddox rod test. It is used in diagnosis of extraocular muscle imbalance. It is a subjective method to assess horizontal or vertical heterophorias or tropias. It doesn't differentiate between these two. It is based on principle of breaking Freeman mechanism. One eye sees the light spot and the other eye sees the red line. The association of light spot and red line is indicator of non-Freeman mechanism of eye. How it is performed? This is the Maddox rod. It has these lines on it. When we are checking for horizontal deviation, we will place it in horizontal direction. These lines will be in horizontal direction, but the patient will see a vertical line. And when we are checking for vertical deviation, we'll put this cylinder in the vertical. The lines will be in vertical direction, but the patient will see a horizontal line. Next thing, we're going to need a trial frame and a light source. It can be performed at the near distance and far distance. Near distance will be 33 centimeter and far distance will be 6 meter. Here's a test being performed. Can I get a volunteer from here to perform this test? I couldn't bring the trial frame. Yeah. Okay. Okay. I'll put it close to that. The distance should be like for near distance will be 33 centimeter and far will be at 6 meter distance. This is not the ideal distance, but we'll perform it there. The should be the parallel. And tell me about how you see the dot and the line. Coincide kare. Okay, now change the direction. Are they coinciding now? Okay. Okay. Thank you so much. Thank you, doctor. Okay. How we interpret these results? Maddox rod is placed before the right eye. If patient is orthophoric, the line will coincide with the light spot. If patient is isophoric, then or isotropic, because it doesn't differentiate them, the patient will see the line on the right side and is corrected with prism base out. And when patient has exophoria or exotropia, patient will see the line on the left side and it is corrected with prism base in. This is we are checking for vertical phorias. So we are putting the cylinder in the vertical direction. If patient is orthophoric, then line and the dot will coincide. And patient is hypophoria, then the line is displaced upward and is corrected with prism base. This is not down, prism base up se correct hota hai. This is a mistake here. And for hyperphoria, the patient will see a line displaced below and is corrected with prism base down. Now tell me what kind of deviation is this? Is this a vertical or horizontal deviation? Horizontal. Okay, is this ESO or EXO? And now patient has become orthophoric and prism will be base in or base out? Base out. Prism base out. EXO है? अच्छा ठीक. Okay, what kind of deviation is this? Hyperphoria or tropia. And how it is corrected? Base down. Base down. Toric surface, it is a surface being curved in both its vertical and horizontal meridians, but not to the same extent. It has maximum and minimum curvature, which are called principal meridians. The principal meridian of minimum curve has minimum power and it is called base curve. This is the base curve and it is minimally curved and it has minimum power. And this is the cross curve, it has maximum curve and maximum power. Toric lenses or spherocylindrical lenses. These are the lenses with one toric surface are called toric lenses. Spherical lens with superimposed cylindrical lens make toric lens. Toric lenses may be defined numerically as a fraction, the spherical power being numerator and the cylindrical power being the denominator. For example, toric lens with +2 diopter in one principal meridian and +4 diopter in the other principal meridian. It is actually formed by +2 diopter sphere with a +2 diopter cylinder superimposed. It is written as follows. The power of spherocylindrical or toric lens is expressed by stating the power of spherical component first, which is followed by power of cylindrical component and finally direction of cylindrical axis. Here is -3 diopter sphere and -2 diopter cylinder axis 90° expressed on power cross. This is how the sphere is presented on power cross. It has the same power in all the meridians. This is the -2 cylinder with axis at 90°, so its power is acting at 180°. So when we add them, then at vertical meridian the power is -3 diopter and at horizontal meridian the power is -5 diopters. Now let's discuss the image formation by toric lens, but we have to understand few terms. Sturm's conoid is the configuration of light rays which are refracted from an astigmatic surface. Circle of least confusion or diffusion is a point in Sturm's conoid in which divergence of rays of one meridian is exactly equal to convergence of rays of the other principal meridian. Interval of Sturm is distance between two focal lines. Here is this straight vertical focal line which is actually formed by horizontal meridian, and the horizontal focal line is formed by the vertical meridian. Between them is the conoid of Sturm, and this is the circle of least confusion which is at the center of it. Now let's discuss these cross section in detail. First, take this example. The horizontal meridian has more power and the vertical has less power, and we are going through this angle. And if we put a screen at different point in the conoid of Sturm, we will get different cross section images. At this point, we will get a vertically oval image. The horizontal meridian is starting to converge like this, and the vertical meridian is still diverging. So we will get a vertically oval image. At this point, we'll get a vertical line because rays in horizontal meridian are completely converged and they will give a vertical focal line. Here we get a vertically oval image, then rays in vertical meridian are starting to converge and the horizontal meridian are starting to diverge now after they have been converged. This is the circle of least confusion. Here the convergence and divergence of both meridians are equal and they might act as they are similar to spherical lens. It closely resembles a point. Here the image is still blurred but is less blurred as compared to other areas of conoid strum. Here we get a horizontal oval image. Here the vertical rays start converging and horizontal rays start to diverge. So the vertical rays are converging like this and horizontal rays are diverging, so we'll get a horizontally oval image. Here we get a horizontal line because the vertical rays converge completely and they will give a horizontal focal line. Here we get a horizontal oval image. Horizontal rays are more diverging than vertical rays. What is the importance of conoid of strum? The patients with astigmatic refractive error see clearly when circle of least confusion or conidostrum is on the retina. Here is the reduced schematic eye model. It has plus 60 diopter power in all of its meridians. What if the patient has plus 58 diopter power in its vertical meridian? Now the patient will need a plus 2 diopter cylinder at axis 180 degrees so that its power can act at 90 degrees. Now the circle of least confusion is on retina, patient can see clearly. Here in this example, take that vertical meridian has plus 62 diopters and the horizontal meridian has plus 63 diopters. Now the Strum's conide is not on retina, as you can see. The patient will need a minus 2 diopter cylinder at axis 180 degree so that its power can act at vertical meridian, which needed actually, which was 62 diopters. And minus 3 diopter cell at axis 90 degrees so that its power can act on horizontal meridian. After the cylindrical correction, now the circle of confusion, circle of least confusion is on retina, and patient can see clearly. The prescription will be minus 2 diopter sphere and minus 1 diopter cylinder at axis 90 degree. What if patient can tolerate cylindrical lens? In the previous example, we said that patient will need minus 3 diopter power and minus 2 diopter different meridians. But if we prescribe it only in the form of sphere, with minus 3 diopter sphere, only the proximal focal line will get focused on retina. And with minus 2 diopter sphere, only the distal focal line will get focused on retina and patient will still see blur. So that's why we calculate spherical equivalent. Spherical equivalent is the power of spherical lens of closest overall effect to a given toric lens. The focal point of spherical equivalent would coincide with the circle of least confusion of the toric lens's terms conide. The spherical equivalent is calculated by adding the sum of the sphere power with half of the cylinder power. Here for this prescription, minus 2 diopter sphere and minus 1 diopter cylinder, the half of 1 will be 0.5 and after algebraic addition we will get minus 2.5 spherical equivalent. When you could give that to the patient, then now the circle of least confusion is on retina. Now let's discuss the cross cylinder. It is also referred to as Jackson's cross cylinder. It is a spherocylindrical lens in which the power of cylinder is twice the power of the sphere and of opposite sign. It is available in two powers, 0.5 and 1 diopter, which is named after the cylinder power. Okay, this one is actually 0.5 diopter cross cylinder and is written like that, minus 0.25 diopter sphere and plus 0.5 diopter cylinder. And this is actually 1 diopter cross cylinder and is written as minus 0.5 diopter sphere and plus 1 diopter cylinder. The plus, this one which is plus 0.5 diopter cross cylinder is used to find power and this plus 1 diopter cross cylinder is used to find the axis. The spherical equivalent of the Jackson cross cylinder is actually 0. The 0.5, half of 0.5 will be plus 0.25 and its spherical equivalent will be 0 and half of plus 1 will be plus 0.5 and its spherical equivalent will be 0. Now how it is made? It is made by superimposing two cylindrical lenses of equal power but opposite sign. They are of equal power but opposite sign. The lens is mounted on a handle which is placed at 45 degree to axis of the cylinders. The axes marked on the lens are axes of no power. The power of each cylinder lies at 90 degrees to the marked axis and it coincides with the marked axis of no power of the cylinder of the opposite sign. This is the axis plus of which is marked as plus 0.25, but its power is actually acting at here. So this is represented on power cross like this. And this is the marked axis of minus 0.25, but actually its power is acting here. So that's how it's presented on a power cross. Now the principle of cross cylinder. The principle of cross cylinder is placing the circle of least confusion by locating focus of each principal meridian at equal diopteric distance on both sides of retina. When determining power, the cross cylinder is cross cylinder either increases or decreases the residual cylinder by either expanding or collapsing the Sturm's interval and circle of least confusion. We actually give two options to patient, and one option will extend this interval and the other will shorten it. For example, in one option, the patient says this is better and circle of least confusion is actually on retina, it is decreased in size, its position is not changed, but the interval of Sturm is shortened. Initially it was this much and now you can see this is the proximal focal line, this is the distal focal line. So the interval of Sturm has gotten shorter. And this is the second option which we gave to patient. It has the circle of least confusion has increased in size, its position is not changed, but you can see the interval of Sturm is longer. This was the initial one, and now you can see this is the proximal focal line and this is the distal focal line. And patient might say that this looks blurred. Cross cylinder is used to confirm presence or absence of cylinder. It is used to find axis of the cylinder and it is used to find power of cylinder. Always refine cylindrical axis before refining cylinder power. This sequence is necessary because correct axis may be found without knowledge of correct cylinder power, but full cylinder power is found only in the presence of the correct axis. Now let's discuss the cross cylinder refraction technique. We will go through it step by step. Step 1 is to find best V in sphere. Step 2 is to use test figures that are 1 or 2 lines larger than the patient's best visual acuity. Step 3 is to confirm the need of cylinder by testing with cross cylinder 1 diopter power at axis 90, 180, 45 and 135 using flip cross technique. If patient prefers one of those positions to sphere alone, then a cylindrical correction is necessary and put 0.5 diopter cylinder in trial frame at a patient prefers axis. Step 4 is to refine axis and step 5 is to refine power. Okay, this is a Jackson cross cylinder. This is its handle. It is placed at 45 degree to its axis, marked axis. Now we will check the axis of the cylinder at these four positions. This is minus 0.25 at 90 degree. When we flip it like this, will automatically it goes to 180 degree. So we are checking it at 180 degree. Now to check at 45 degree, I will place it like that. Now it says 45 degree, and when we will flip it, the minus axis is at now 135 degree. Okay, so that's how we check the axis of cylinder. Now how we refine the axis of the cylinder. The cross cylinder 1 diopter power is held with its handle in line with the axis of the cylinder. Cross cylinder is turned over and the patient is asked which position gives better visual result. Axis of tri-cylinder is rotated slightly toward axis of the same sign on cross cylinder. Cylinders are rotated in small increment of 10 to 15 degrees. This process is repeated until both flip choices appear equal. Here take this example. This is the axis of the cylinder which is in the trial frame. Now we are refining the cylinder power. So we'll put the handle of the cross cylinder which is aligning with the axis. Now we'll give two choices to the patient and flip choices. Is this is better or this is better? As there is already a minus cylinder in the trial frame, so we will move the cylinder axis towards the minus sign. Here the minus sign is here. So if patient prefers this position, then the cylinder is slowly rotated 10 to 15 degrees in this direction. Okay. And if patient prefers this flip choice, then now the minus axis of the cross cylinder is here. So the cylinder in the trial frame will be rotated 10 to 15 degrees in this direction. Now how we define cylinder power? Cross cylinder 0.5 diopter is held with its axis aligned with principal meridian of correcting lens. Change cylinder power according to patient's response. If patient finds it clear when plus sign on the cross cylinder is in line with cylinder axis, add plus 0.25 diopter. If patient finds it clear when minus sign of the cross cylinder is in line with cylinder axis, then add minus 0.25 diopters. Continue until both orientations look the same to the patient. Now take the same example. Now we have to align the axis of the cross cylinder with the trial cylinder. Here the minus axes are aligned with the axis of the cylinder in the trial frame. Now then we flip it, then now the plus axes are coinciding with the cylinder axis of the trial frame. So if patient prefer this position, then we will add minus 0.25 to the existing cylinder. So the power will become 0.50 to 0.75 हो जाएगा, minus 0.75 हो जाएगा. Or if patient prefer this axis, plus axis, then we will add plus 0.25 and then the power of the cylinder in the trial frame will become minus 0.25. The spherical equivalent of refractive correction should remain constant to keep the circle of least confusion on retina. This is done by changing the sphere half as much and in opposite direction as cylinder power is changed. For every 0.5 diopter of cylinder power change sphere by 0.25 diopter in opposite direction. If we don't change the spherical power, then circle of least confusion is displaced from retina. And when we change it, then it comes back on the retina. So in simple terms, if we are increasing the minus power of cylinder, then we have to make sphere more plus power to keep the circle of least confusion on retina. Let's do some MCQs. Which prescription presents a Jackson cross cylinder? The one whose spherical equivalent will be 0. Yes. A is the correct answer. Which of the following is false about conioidal term? Image is at the center of conioid circle. Image is at the end of conioidal lines. It is a three-dimensional image formed by a spherocylindrical surface. The circle of least confusion is at center of conioidostrum. The length of the conioidostrum decreases if the differences between two foci of spherocylindrical surface increases. नहीं मल्टीपल है ना टू फॉल्स नहीं सिर्फ एक फॉल्स है E is the correct answer. Yes, E is the correct. And that's the end of the presentation. Thank you for listening.